Had a little bit of a speaker glitch, so I'm going to do the final session on Contact and Connect. So this is the project that we've literally just finished on, or we're still sort of in the process actually with Kirklees and just deploying in Gateshead. So this is all about automated telephony, and as we said in the first session, automated telephony isn't new. It's been used for decades probably, but I think it is quite new in bringing it into adult social care. And all of it came from the Skidia process again, those 50 applications that we had from local authorities I mentioned before. A number of them identified automated telephony as a potential way of supporting and improving adult social care services. And again, going back to that sort of resource capacity kind of challenge that everyone's facing. So as part of the Skidia, a technical provider who's worked in the NHS and housing sector for many, many years applied, but it wasn't chosen as a Skidia project. And if we go back to those golden rules I outlined at the start, it was because the technology is already there. It just hadn't been deployed in adult social care. So the Skidia went off and ahead, but we kind of recognised that there was, an interest and a need from local authorities to think about adult social care and automated telephony. So we brought a separate collaboration together. So Sunderland, we heard from them earlier, Gateshead and Kirklees all joined this project, and they had an open brief. They chose which service they wanted to focus automated telephony on. We heard from Emma, they've chosen community loan equipment, and some of the drivers behind that decision, supply chain issues, even more relevant right now, just reusing stock, recycling equipment, and just making better use of their stock, all drove them to that particular service. And in Gateshead, supporting people in reablement, and I'll go into a little bit about why they made that choice in a moment. So if we go to the next slide, I think there's a little bit of delay on the slide, so I think we all feel like Chris Whitty, and Sam's probably in the background going, I've pushed the button already. But anyway, Sam, it's all good. So we're working with VoiceScape, and this the automated telephony services are called Contact and Connect, and they prioritize mobile numbers. And it is automated telephony, but it also has sort of the backup if people don't answer of SMSs as well. So it sends a text message and allows people to respond to the relevant questions and tell the authority how they are via text as well. The dashboards and the sort of metrics and reporting are really granular, obviously goes into each individual person and the questions and their responses. And also the platform, which is really interesting, particularly for reablement, is that it has alerts. So if someone's got a problem, it can alert immediately the relevant team member to try and pick up and maybe stop them going back into the GP or stop them going back into A&E. So we had some collaborative learning, even though each local authority progressed sort of in isolation rather than in a collaborative way as in a number of the other projects. There was some learning around this, and obviously the first one is about the audience. So the audience here in adult social care is mostly older people, and it was just trying to understand how we could best deliver them an automated telephone call and make it relevant and make them engage with it. So obviously, some people have hearing difficulties, some people might not have English as their first language. So we use text to speech rather than a recorded voice. So that's a digital way of delivering the questions. Again, it's kind of normalized now. We've all heard those kind of calls. It also gives us the ability to speed up and slow down conversations, which is sometimes what I need to do. I sometimes need to slow down. And in fact, in all of the automated telephony projects, we've had to slow down the recordings. So we keep the questions to around 5. It's about a 2-minute call, and there's just there's 2 answers to each questions. Another key bit of work that we did with each of the local authorities was around scam calls and differentiating these calls from scam calls. So the service uses a known local number. We spend quite a bit of time introducing the service to people. In reablement, that's when that reablement package and the carers leave the person. They're given flyers. They listen to a demo call and so on. So there's a range of marketing activities and initiatives that go on to ensure that people know when they're coming. They come at a regular time of the day, and the message in the script also includes the council's name, and in some cases the person's name, to make it that much more personal. I think the final thing was around data identification and cleansing. So if you just pop back 1 second, the idea is that we extract the right names and the numbers to get the calls every week. And that can either be done in Sunderland's case, they do that manually, so they do a manual upload of the data, but it can be automated, and that's what's happening in Gateshead. So they just manage that via SFTP. But identify the data, making sure it's clean, extracting it, and so on can take a bit longer than expected. So now that we've done the sort of proof of concepts and stuff, we're approaching the project in a little bit of a different way, and are prioritizing that more towards the start. Brilliant, let's crack on. Oh, I've got another poll. Excellent. I do love a poll. And the system allows it. So I was wondering if people, from listening to what Emma and Julie were saying this morning around automated telephony, from understanding it just in our own lives, wondering if there are any services that you think might be relevant to have an automated telephony approach in your organisation. We spoke with local authorities, getting them involved in the collaboration for about 4 or 5 months. And there were a number of ideas that came up during those conversations. So Sunderland, in fact, already, as they mentioned, thinking about scripting Pathway Zero calls. There's definitely a lot of conversation around social isolation and signposting to community services. Back in the first lockdown, there's some real, local authorities use automated telephony to support people who are shielding, ensure they had the right medication and food packages and so on, and prioritize COVID response. So that's been an ongoing theme as well. Equally, maybe community messaging around flu jabs, vaccine take-up, that kind of stuff. Not sure if that falls a bit too much into health, but maybe just community messaging more generally. And also medication reminders came up as a potential use case. Reminding people on a daily basis, or on however regular it needs to be, to take their medication, and if they were having problems, to get in touch. So it would be great to see if your thoughts on that, and if there are any other ideas that I haven't mentioned already, just put them in the chat box. Really keen to look at those. So if we go to Sunderland, and I go back to Sunderland and the sort of project learning there, we heard from Emma and Julie. They wanted to get more equipment back into the system. I think they recognised there was about 50% of their equipment wasn't coming back into the system on a regular basis. And when they're loaning out, I think 300 odd pieces a week, that's a lot of equipment that's not coming back. They have a dedicated centre that harvests, recycles the equipment for redistribution. And particularly now in COVID, they've got an isolation or a cleansing process that means that their stock is sort of sat dormant for a long while before they can redistribute that. So that was their main driver. But I think we heard from Emma, it's the ongoing conversation with their clients that has really benefited them more. Just gonna have a quick glass of drink of water. Please enter the poll as I just do this, sorry. There we go, sorry about that. So I think what they also were interested in was streamlining and consolidating the recall process. I think they've got over 200 prescribers of equipment across their patch. So actually, improving the way that the system actually works was something that they were looking to achieve, and just have better oversight across it all. So there's some facts and figures there. These are real facts from Sunderland, real figures. So a lot of equipment going out, just over 45,000 pieces every year, 100 people coming into the system every week, getting multiple items, 380 items every week being loaned out. So you can see the cost there of the equipment every year that Sunderland are spending out. And we mentioned the supply chain issues and all of that. So, actually buying new equipment, ensuring it's relevant for people's needs, and so on and so forth. It's a big task, and this automated telephony service is really supporting not only those items coming back in. I think in the first 3 weeks they've had over 100 items actively be said, I don't need it anymore. So they've gone and picked those up. They've also identified some that have been tampered with, and and some that you know, where people's needs have changed and actually they need something else to support them. So it's all really good stuff coming back in there. I think the next slide is around those proven benefits. I think you probably heard most of that from Emma this morning. She's really a positive advocate. I think I've got to say that we were pretty blown away, and they were too, with the amount of change and the amount of impact the service has had just in these first few weeks. I think it only went live on September the 6th, I think. So they're definitely seeing those staff, the call centre staff, being improved in their skills and becoming sort of care navigators in their community. They're seeing more equipment coming in, and they're moving more, as we were discussing, to that sort of preventative side of the piece. So I think, you know, it's early days, but they're looking at potentially what's that, 2,300 additional pieces of equipment coming back in every year. So that's on top of what was already coming back in already. 17% more equipment coming back in. So that's got to, you know, address your bottom line in terms of paying for new stock and so on and so forth. And there's obviously the environmental benefits we touched on there as well. If we move to Gateshead, this is something that we haven't quite we haven't gone into detail yet. So I'll spend a bit of time talking about Gateshead's use of Contact and Connect and automated telephony. So this is particularly around post-reablement support. Gateshead and many others that we've spoken to since were having a high level of people representing at A&E or GP surgeries once their reablement packages had come to an end. I think it was recognised, and, you know, obviously impacted by COVID, you know, the increasing social isolation of people. But what they really wanted to do was sort of stop this representing at A&E, stop people coming back into the system, back into reablement. It just seemed to be a cycle that something needed to be done to address, and there was sort of a large amount of associated costs there as well. I think they also felt that there was a bit of a lack of engagement with community services that were out there. People didn't know how to get to them, didn't know, you know, how they could support them. So this system also addresses that in terms of signposting people. But what we found when we started looking at the scripts was that actually there's some reporting and sort of internal and external reporting that the calls can support. So it was particularly around that sort of ASCOF2B, the 90-day call, where everyone gets that call at 90 days to find out where they are. In Gateshead, that's a really manual process about identifying who should be getting those calls, making those calls, and so on. So we're trying to quantify, you know, how much time that takes, you know, and therefore the cost, and try and automate some of that to basically allow those people, like we heard from Sunderland, to have better conversations with people based on answers that they've got in front of them. So I think, yeah, there's about 1,900 people every year going through the reablement pathway. So stopping even 10% of those people going back to A&E, or 10% of those people going back, you know, spending a night in hospital or back to their GP, there's some significant savings that we can see across the health and social care system. So the expected benefits are very much that, decreasing the number of people back into A&E, are helping those overstretched resources, OTs, dom care, you know, right across the piece, to support the priority cases. But very much, I think, and Sam, if we can move to the next slide, it's very much about people still being in the system and still having that kind of safety belt of knowing that someone's checking in on them, that if they need to, there's a number at the end of the call. And my colleague Sam, who's just talking about virtual support, will do the session on Contact and Connect at lunchtime, and he'll play you he's going to play you the call so you can actually hear how they sound, hear the responses, but also hear those kind of catch-all or follow-up messages that you can give via the system. So in the case of Gateshead, you know, they give a number for someone based on, you know, based on a sort of tree and branch kind of question and answer. You know, if people who end up down here, they get a telephone number should they need any more help. And if people are saying they're having problems with their medication or so on, the system sends an alert to the right person to actually get in touch with them and support them with their medication, to moving again into that preventative space, trying to stop them coming back into hospital and so on. I think it's in Sunderland, where actually they've got some videos on YouTube where they support people around community loan equipment and how to use it. So that's quite interesting. That will also be linked in very soon. So once someone said, you know, I've still got the equipment and there's a question, or maybe I don't quite know how to use it anymore, then a link can go straight to send someone straight to a video of how they're going to do or how to support them to use that equipment. So I think, you know, it's really bringing in all the different assets that authorities have around equipment, around reablement to better support the person and the patient customer. So the lunchtime session is going to do a demonstration of calls. Sam's going to go into detail around the dashboard and reporting, and I think that's sort of really, really interesting, the sort of granularity of the information that you get in that. As with all of these projects, we've created a detailed business case for both reablement and community loan in partnership with Gateshead and Sunderland. So, you know, figures, we can work out figures that are relevant to your particular area and your particular caseloads. Again, we've probably been working on this maybe about 5, maybe 6 months. You know, obviously people have got their day jobs to do, so we've taken it out of the authorities, but we're probably able to squish this down into a sort of 6-week process. So Sam will walk through those steps, the requirements and the speed, and the people that need to be involved to deploy these services. I think you're also going to outline the questions for all the 3 services, but including the ASCOF 2B. As we've said, you know, the automated telephony solution and technology exists. So we're starting to work with others. Oh, let's go to the poll. Let's see if there's some answers to the poll that I can bring in. So as I say, Sunderland are keen on the Pathway Zero idea of scripting that as a new service. Looks like there's potentially some, you know, traction or interest in automated telephony around social isolation. And certainly, you know, we spoke to a couple of people who used that in COVID and they were getting really great results, you know, over thousands and thousands of people, and being able to prioritize their responses accordingly. So yeah, open Q&A session with Sam, and we've got a couple of fact sheets and the little pictures of them there. So if you're interested in the product fact sheets, then we can send those over. As we've said, all of the lunchtime sessions will be recorded. So please, if you go back to that original poll around which of these 6 platforms might be of interest to you, if you can't make it over lunch, we obviously can only make it to one, then we can follow up with the recordings of the other sessions. So I'm just having a quick look at the chat. Yeah, okay, so as I say, everything's going to be recorded, and we can share those later. So I think my colleague Sam will drop in the link to the other Sam, we've got 2 Sams, to his lunchtime demonstration.